Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Farouk bin Sufyan and I'm from SA113-4C. So let's move to the next slide. It's about our client biodata or detail about him. So his full name is Muhammad Fakrul Hakimi bin Abu Bakar. Education, for now he already study in Diploma Sports Science. The sport that he play in football. So next is sport involvement. He already play in state level and university level. The sport achievement, he already achieved for Piala Belia or APTA and Piala Kementerian Malaysia. So the year that he start playing sport is on 12 years old, and the year that he got injury is on 2016. ACL injury on the right knee. So how he can get injury? When that time he crashed with the opponent during the game. So the time taken to heal or recovery, he said it's about 8 months for the recovery and healing session. So I think that's all about his biodata or his detail. So thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Al-Amin Ashraf bin Zulkifli. So today my group and I will discuss and present about the knee injury. So in general, knee is a complex and largest joint with many components that play an important role in the part of the body. It connects the thigh bone, which called femur, to the lower leg or shin bone called tibia. Next, knee can be classified as a synovial hinge joint that function to permit the flexion and extension of the lower leg relative to the thigh. Hence, the range of motion of the knee is limited by the anatomy of the bones and ligaments that allow around 120 degrees of flexion. So, the knee injury is a common injury in sports. Knee injury can affect any of the ligaments, tendons, fluids, or bursa that surrounds the knee joint, as well as the bone, the cartilage, and the ligaments that form the joint itself. The knee injury can be fracture, may happen caused by the twisting or bending force applied to the knee, or a direct blow, fall, or an accident. The risk of this injury include of the improper turning, wearing improper shoe, and also play a high impact sports that involve a sudden changes in direction. In addition, the knee injury is not only having by the athlete, but everyone may have the risk of having this knee injury, since the knee is an important part of the body that may help a person or everybody to do the life routine activities such as run, walk, and jump. So now we move to the anatomy of the knee. The knee is made up by 5 main components, which are bone, ligaments, articular cartilage, meniscus, and tendon. First, we go to the bones. There are 3 bones meet to form your knee joint, which are thigh bone or called femur, shin bone or tibia, and the kneecap or patella. Next is the articular cartilage. This part is the end of the femur and the fibula. The back of the patella are also covered with this articular cartilage. And this slippery substance will help your knee bones glide smoothly across each other as you can bend or straighten your legs. And then we have the meniscus. Meniscus is a two-wedge shaped pieces of meniscal cartilage as a shock absorber between the femur and the tibia. Next is ligament. Bones are connected to each other by the ligaments. The four main ligaments is in your knee as like strong ropes to hold the bones together and keep your knee stable to a movement. There is two types of ligaments. First, we have the collateral ligaments. These are found on the side of your knee. The medial collateral ligament is on the inside of your knee, and the lateral collateral ligament is on the outside. They control the sideways motion of your knee and brace it against unusual movement. Next is the cruciate ligaments. They are found inside your knee joint. They cross each other to form an X with the anterior cruciate ligament in front and the posterior cruciate ligament in back. The cruciate ligaments can control the back and forth motion of your knee. And the last part of the knee component is tendon. Muscles are connected to the bone by the tendon. The quadricep tendons connect the muscle in front of your thigh to your patella. Stretching from your patella to your shin bone is the patella tendon. Okay, next we move to the type of the knee injury. The knee is composed of the several essential structures, and any of each might be damaged. Fracture around the knees, dislocation and sprains, and also the tear of the soft tissue such as the ligaments are the most frequent knee injury. In many situations, injury to the knee involve more than one component, and the most frequent symptoms of the knee injury are pain and swelling. And furthermore, your knee may catch or lock up. The instability and the sensation of the knee is giving away are common symptoms of the many of the knee problems that having the knee injury. So the first common knee injury is fracture. The patella is the most often fractured bone surrounding the knee. Fracture can also occur at the end of the femur and the tibia, where they connect to create the knee joints. Many of the fractures around the knee are caused by the high energy trauma, such as falls from a great height or car accident. In the term of sports, this injury may be happen caused by the high impact from falling caused by the other athletes, such as the tackle situation in football sport. The second injury is dislocation. It may occur when the bones of the knee are out of the place. They are completely or partially. For example, the femur and the tibia can be forced out of alignment, and the patella can also slip out of place, and dislocation can be caused by an abnormal in the structure of a person's knee. In people who have normal knee structure, dislocations are most often caused by the high impact trauma, such as falls, motor vehicle crash, and related to the sports contact. The third common injury is the most popular knee injury to the athlete, which is anterior cruciate ligaments, or called ACL. The anterior cruciate ligaments is often injured during sports activity. Athletes who are participate in high-demand sports like soccer, football, and basketball are more likely to injure these parts of the knee joint. By changing the direction rapidly or landing from a jump incorrectly can tear the ACL, and about half of all injury to the anterior cruciate ligaments occur when there is the damage along it when the structure of the knee, such as articular cartilage, meniscus, or other ligaments are affected. Next is the posterior cruciate ligament (PCL) injury. The posterior cruciate ligament is often injured from a blow to the front of the knee while the knee is bent. This is often occur in the motor vehicle crashes and sport-related contact, such as the goalkeeper landing from the safe in the footballs and the opponent crashing. The posterior cruciate ligaments tear tend to be partial tear with the potential to heal by their own. And the last common knee injury is the meniscus injury. During athletics, sudden meniscal tear are common. Tear in the meniscus can happen when you twist, cut, pivot, or be tackled. Meniscus tear can also be caused by the characteristic of age. If the menisci have deteriorate with the age, and compatible twist when getting up from a chair may be enough to create a rib.
Assalamualaikum warahmatullahi wabarakatuh. My name is Farah Natasha binti Sukarman and I'm from SR113-4C. Okay, today I will present about the subjective or ACL injury and the treatment. Our client suffered ACL injury which is in both of the knee and cause difficulty moving. ACL injury is microtrauma because it involves ligaments. Sometimes ear popping sound is a symptom that someone have some or any injury at the injured part like knee. After that, he always feel painful and suffering if he want to walking comfortably because the ligament and the bone is rubbing together. ACL have torn in one or more of the tissue in the ligament. The injury is in the third grade of ligaments because he was do the surgery and it means the injury is danger or pain. Next, we move to the second part which is behavior of the symptom. Pain that he describes such as swelling, tightness, pain when cool and unstable when walking. Meanwhile, the pain scale he experienced was 7 out of 10 because after he underwent surgery, pain was sometimes felt when walking faster or running. Also, it can affect him because he finds it difficulty to exercise. The injury is localized and does not spread to other ligaments or other parts of the body.
Assalamualaikum warahmatullahi wabarakatuh. I'm Nur Atifah binti Muhammad Aziz from SR113-4C. Okay, I will continue about the causes of the mechanism of injury for ACL injury. Okay, ACL injuries can happen when the foot is planted firmly, the knee is locked while twisted at the same time. Next one is sudden change. It also will lead to ACL injuries since it put a lot of stress on the ACL. Last one is tibia is rotated and pushed forward in the relation to the femur. For this one, it often happen because of falling when do a skiing activity. Okay, the causes of these ACL injuries can be divided into two, which are contact and non-contact. Okay, for the contact, it may result from the direct blow to the knee or a collision. Okay, if a direct blow is applied to the knee, the ligament will subjected to too much stress, and this can happen as the result of an impact such as tackling in football. Okay, next one for non-contact. This mostly happen when the athlete suddenly turns to the opposite direction of the planted knee. Okay, among the causes are first one, changing direction quickly. Okay, when the athlete changing their direction in a explosive way, if the knee turns but the foot does not, it will cause to ACL injury to happen. Okay, next one is landing awkwardly or landing in an incorrect way after making a jump. The last one is make a sudden stop. Okay, next is sign and symptoms of ACL injuries. First one is popping sound. When the scene happen, we will hear the loud pop or a popping sensation that happen in the knee. Next one is swelling. Okay, when the ACL is tearing, the vessel on the ligament will fill the joint with blood. This condition, we call it as a hemarthrosis, where it will cause swelling, redness, bruising, and a bubbling sensation in the joint. Okay, the third one is pain. Pain can be vary depending on the severity of the injury. Much of the pain of an ACL injury is due to the swelling on the joint. Most of them will not able to continue the game because of the pain that they felt. Okay, the last one is instability. The serious ACL injury may lead the patient to nearly impossible to walk, but less serious of injury may only cause a moderate pain, stiffness, and feeling of instability. Okay, that's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurhani Azira binti Makno. I'm from SR134C. So I will continue the presentation with objective of this SOAP notes for knee injury. So the first one is range of motion test. So for this test, I choose a knee extension. So the range of motions of a joint refer to its ability to move from full extension to complete flexion, which is bending. Range of motion or ROM is a measure of flexibility that involves ligaments, tendons, muscle, bones, and joints. Therefore, testing for range of motion is critical in measuring fitness and detecting potential injury. The purpose of range of motion testing for ACL is to determine the specific motion that contributes to reduce range of motion, the necessity for range of motion testing. So, knee extension is the exercise that has been used at this period. The range of motion test will tell us how many degrees the patient can do. The therapist will do this to the patient, utilizing their expertise in order to prevent additional damage. So the second one is strength test. For strength test, I choose knee extension resistance test. Resistive strength testing is when athletes perform the isometric contraction while the trainer tries to break the contraction. The strength test that can be done for ACL is knee extension resistance test. So the extension resistance test is used to execute a maximum provocation on the muscle tendon mechanism of the quadriceps femoris, which is an extensor muscle. Okay, when the afflicted knee has less power to bear the pressure, the extension resistance test is positive. If the answer is yes, we can state that the knee's extensor mechanism is faulty. Next, terminal knee extension exercises are beneficial because they assist strengthen the quadriceps, which are essential for leg extension. TKE relieve knee pain by strengthening the muscles involved in leg extension and putting less strain on the actual knee joint. So the third one is special test. Anterior drawer test is the one that I choose for special test. The special tests in objective include active range of motion and passive range of motion. For active range of motion, there will be the athletes actively contract their muscles. When they do the breath exercise, there is no more pain while they do, so they can assess the active range of motion and painful arc. By this action, they can detect the pain that occurs at the same point during range of motion, but later disappear as the knee moves to other direction. Meanwhile, for passive range of motion, the athlete should be in relaxed position. In this phase, any abnormal sign must be recognized for safety. The anterior drawer test could be used to diagnose ACL. The anterior drawer test is a physical examination used by clinicians to assess the stability of the anterior cruciate ligament in the knee. This test, along with pictures and other tests, may be used by doctors. So, these tests may not be as accurate as other diagnostic methods in detecting an ACL damage. An anterior drawer test is generally complete in less than 5 minutes by a clinician. I pass this presentation to other my group members. Thank you.
So let's move to the next slide. So for this slide, we'll talk about the assessment that he should do. So first of all, he need to find a doctor, a correct doctor, and meet that doctor for the discussion. So depending on the severity of his injury, he may be referred to a doctor specializing in sport medicine, or a specialist in bone or joint surgery, like orthopedic surgeon. So when he meet doctor, that kind of doctor, discuss clearly about the injury ACL, and try to get all the information given from doctor without any misunderstood. So when he miss something, when doctor say to him, he need to ask on the spot to avoid some misunderstood not clear information. So after that, apply rehabilitation like physiotherapy and exercise on the knee based on the time given that doctor given for he, and don't try to skip any session of rehabilitation. So immediately meet after that, when the recovery session or healing session, immediately meet doctor if there are something wrong, or when rehabilitation exercise session. Rehabilitation and return to normal function after surgical repair of an ACL tear can take 6 to 9 months. So it's a long time. So please make it serious and don't play around. There need to be a balance between trying to do too much work in physical therapy, returning strength and range of motion, and doing too little. So I think that's all about the assessment. So let's move to the next slide.
Okay, next, treatment for ACL injury. There are two parts consist of short term and long term. The treatment for short term is RICE method. Begin providing first assistance as soon as possible. These first aid recommendations will help you deal with swelling and pain. Apply the RICE technique. The letters stand for rest the knee, ice it, and apply an elastic bandage to gently compress the knee and elevate the leg by raising it above the level of your heart. It also vital to move your leg as little as possible initially. While someone with an ACL damage can continue to bear weight, resting and restricting weight bearing may help reduce knee swelling to minimum. Okay, for the first is rest. Rest means stop all activities and rest as much as possible for the first 2 days if you are injured. Don't attempt to adhere to the no pain no gain attitude. The second is ice. The cold will help to decrease discomfort and swelling. Apply an ice or cold pack immediately to prevent or reduce swelling. Apply the ice or cold pack for 10 to 20 minutes 3 times a day or as needed. If the swelling has gone down after 48 to 72 hours, apply heat to the painful region. Direct application of cold or heat to the skin is not recommended. Before putting the cold or heat pack to the skin, wrap it in a towel. Okay, third is compressions. Swelling can be reduced by compressing the damaged or painful region or wrapping it in an elastic bandage such as ACE wrap. Wrap it loosely as this might create further swelling below the afflicted region. If the bandage becomes too tight, loosen it. Numbness, tightening, increased discomfort, coldness or swelling in the region beneath the bandage are all indications that the bandage is excessively tight. And the last one is elevation. Elevate the injured part of painful region using cushion or pillow while applying ice and wherever you sit or lie down. To assist reduce swelling, keep the region at or above the level of your height. Do not pressure the injury part with heavy load or any heavy movement. Okay, for long term is bracing. Wearing a brace can help keep your joints moving naturally and help prevent injury. For those who have sustained previous injury, a brace can provide added support and stabilization so you can return to sports or work, accomplish everyday tasks without pain or weakness. Apart from the physical benefits, the right brace can also give you the confidence to move more freely without the worry of hurting yourself again. Other than that, it can help the athlete to reduce pain, swelling and bruises. Bracing also provide support if he want to walking or do some movement like squat, and it can help the athlete or the patient to increase their self-esteem to feel more secure and stable. Okay, I think that's all from me. Now let's move to the next point. Thank you.
Okay, for now, I will present or explain about the exercise that need to be done or clinical training in the gym or home. So, after an anterior cruciate ligament (ACL) injury, you lose leg strength and motion and stability of the knee. It is important that you regain your leg strength and motion as soon as possible. Whether you choose to have surgery for your ACL injury or not, exercise to regain muscle strength and knee motion should begin before you start treatment. Whether treatment is rehabilitation program only or surgery plus rehab. So after an ACL injury, your knee will not be stable and may be painful and may have a limit range of motion. You have eventually developed osteoarthritis in the knee. So from this we can not move our knee over our limit, lots of movement. If you do exercise to strengthen your tight muscle, quadricep and hamstring, and regain knee motion soon after an ACL injury, you will be better prepared for a rehab program or for surgery with a rehab program. So you should start slowly and gradually increase the intensity of the exercise. Do not push yourself to the point that you feel pain. So the exercise that commonly for ACL is there have 9. So the exercise is bridging, glute set, hamstring curls, heel raise, heel slide, quad set, swallow standing, knee bend, straight leg raise to the front and straight leg raise to the outside. So all this exercise should be done in the recovery session or in the healing session before you start the rehab program to give you more smoothly when you do the rehab program. So all this exercise is very helpful for you to more easier in the rehab program. So I think that's all about the exercise for ACL injury. Let's move to the next slide. So let's continue the next slide after the exercise that should ACL people do. So for this slide, we talk about the do and don't for ACL people. So there are 4 that they need to do. First, keep your knee straight. Second, wear your knee brace. Third, physical therapy, do physical therapy or physiotherapy. And the last one, go to your schedule, follow up with your knee surgeon. So keep your knee straight. First point, it will not be comfortable, but it's vital to keep the knee joint completely straight immediately after your ACL reconstruction. This gives the joint time to heal properly without stressing your newly fixed ligament. So next, wear your knee brace. So it's as we know, if we wear a knee brace, it's have a little bit uncomfortable and hot, and maybe a little inchy, but it will help us to protect and stabilize our knee while speeding up our recovery. So try to wear it everywhere and all the time. So let's we move to the tone that ACL people cannot do. There are three that ACL people can do. Don't. So for the first one, don't try to put weight on your new knee. It means that don't try to put a lot of weight on the knee that face on the ACL injury. Next is don't walk, swim, cycle, bend and extend your knee until you are clear to do so. The third one is don't do a lot of movement or move your knee over the limit. So these three criteria will affect you to the bad effect and can drag your time to the rehabilitation or healing session or recovery session. So I think that's all about the don't and do for ACL people or ACL patient. So I think that's all. Thank you.
So I will continue the next presentation with rehab program for 12 weeks. So this slide is about rehabilitation program for 12 weeks that used by ACL patients. Based on the table of the program, the first phase is for week 1 until week 4. In this phase, the intensity that they use is about 30% because it is so early from their operation. So the target by this week is to ease stiffness and pain. So for the second phase, this is for weeks 5 until week 8. For this phase, the intensity will increase to 55 until 65%. It is because they have to go through the simple exercise that can make sure their knee can do a movement. Then the target for this phase is range of motion, strength, and balancing. Lastly, the third phase is for week 9 until week 12. For this phase, the intensity have increased to 75%. So in this time, their knee might recovery like 50 to 70%. They will do more active exercise and continue progressive and strength training. They have to check back their knees and before they can back to their sport by therapists. Okay, I think that's all from me about the rehabilitation program. Thank you.
So, in conclusion, SOAP-NOT is the method involve the objective observation with mean factor that can measure, see, hear, and feel. This method is an effective approach and technique of the recording in the diagnosis of the athlete injuries. In fact, this injury or this ACL injury is a common injury to athlete where the anterior cruciate ligament affected caused by the sport participation. The proper rehab are very needed to ensure the athlete can continue his or her career in sports, like our client for this species, acrohactemy. And lastly, the awareness of this injury are also needed to make sure the people are aware of this injury need to be avoided by do the warm-up and stretching session before do the physical exercise or performing in sports. So I think that's all for my group, and I hope you guys can get all of the information clearly from my group. So thank you so much for watching this video. Assalamualaikum.